This is a Walker Street Doctors update for November 2021. COVID has presented us at Walker Street Doctors with an extraordinary opportunity to rethink how we do things in the healthcare industry and what general practice should or could look like in the years to come as COVID Delta strain and in the future COVID Epsilon strain and others start to circulate freely in our community. The vast majority of our patients are fully vaccinated and many are putting their hands up for boosters. But even despite vaccination, there are underlying conditions and comorbidities which put many of our patients at risk of poor outcomes from COVID, malignancy, especially hematological, immunosuppressant medications which people might take for rheumatoid arthritis or Crohn's disease, diabetes, pregnancy, and the big one, obesity. The traditional model of general practice looks like a large waiting room filled with patients with all sorts of ills, sitting right next to each other, maskless, for long periods of time as the doctor makes them wait. In a traditional general practice, we could well see a 6-year-old with a cough, maybe COVID, maybe not, sitting next to a 25-year-old man with morbid obesity, but otherwise well, a pregnant woman, a 45-year-old woman undergoing chemotherapy, a man in his 60s who has ischemic heart disease, a woman in her 70s with chronic lung disease, and a frail elderly man in his 80s. And that would be a pretty run-of-the-mill general practice waiting room. So if that 6-year-old did have COVID and she wasn't wearing a mask, she's just put 6 other patients at risk of severe COVID despite their vaccination status. Telehealth video consultation with the help of our HotDoc booking platform has allowed us to consult with each and every one of these patient types in the comfort of their own home, office, workplace, car, or local park. No mask required. As we doctors learned on the very first day of medical school and in every training program thereafter, 90% of the consultation is in the history taking. The patient will tell you what's wrong with them if you give them the opportunity. And of course, hands-on examination is sometimes required in general practice, but not always. Cervical screening can't be done via telehealth, although self-collected samples will probably be not too far away. Immunisations can't be done via telehealth, but most other things we can at least start with a video consultation and finish with an invitation for a brief examination in the surgery. A high-resolution photograph of the area involved, for example, leg wound, skin lesion, skin rash, inflamed throat, or the video of a child's obstructive snoring are just some of the tools which my savvy patients get to me ahead of the consultation to enhance the experience of the video consultation. Other patients might email me a list of their blood pressures from the previous month or the ECG from their smartphone during an episode of palpitations. From our end, COVID has pushed our industry to improve efficiencies. E-prescriptions are now standard, a QR code for the prescription emailed or texted to your phone. Our patients can now talk to their local pharmacy to set them up with an app to store their repeats. Our software is enabled to email your referrals directly to your specialist or allied health provider's email address and also to yourself right from our desktop. Fax has finally become a thing of the past. Driver's license medicals can be electronically submitted to the RMS, assuming that we've got a recent optometrist or ophthalmologist letter to submit with it. Pathology results are automatically uploaded to My Health Record 7 days after they're reported. Pathology requests texted to your phone are now standard. Radiology requests are sent electronically to Harbour Radiology as a default, and other radiology providers in the area are catching up. Telehealth is here to stay at Walker Street Doctors. We love it, and we know that most of you do too. Our mission at Walker Street Doctors every day since the first day we opened our door in September 2012 is to provide the highest quality of healthcare to our community at all times. To us, this means not only practicing the best quality medicine, but also keeping our patients safe and being early adopters of information technology to improve patient experience and their outcomes. On the subject of COVID vaccination boosters, although most of our patients will have reached their 6 months in February and March of 2022, we do have a number of patients who are vaccinated early and are getting close to their 6 months over the Christmas and New Year period. Mostly these patients are doctor patients, other healthcare workers, patients at high occupational risk, and patients aged over 50 with comorbidities. And although ATAGI has approved the booster after 6 months after the second dose of the primary course, they also have now given us as clinicians a little bit of leeway to apply clinical judgment for specific patient circumstances or off-label use. For example, if a 70-year-old with comorbidities was travelling to the UK for Christmas 5.5 months after their second dose of AZ, it would be prudent to offer them a booster prior to travel. Pfizer only has been approved as the booster vaccination to date, irrespective of the primary course. So please do call us to book in for your booster dose at the appropriate time. Mostly we'll be doing these on a Friday afternoon, but they will spill over into the rest of the week if we need to. For severely immunocompromised patients who've already had their third dose of the primary course, a booster dose, so that is a fourth dose, is not recommended at this stage, but watch this space. For children aged 5 to 12, Pfizer vaccination at a third of the adult dose is now in full force in the US. The vaccination program in this age group appears to be safe and efficacious in trials. Australia is still watching what happens with post-marketing surveillance prior to authorising vaccination in this age group. There are 2 other arms to the childhood vaccination trial. Children aged 2 to 5 and babies from 6 months to 2 were given 1/10 of the adult dose, and those trials also appear favourable. Watch this space. Prevention is always better than cure. So in addition to vaccination, please take the opportunity as we come to the end of the year to get into the best physical health in case COVID does come your way. 8 hours of sleep, moderate intensity exercise most days, 5 serves of veggies and 2 serves of fruit every day, stress less, meditate more, spend time in green space and sunshine, supplement if appropriate, and drink less alcohol. There are now effective intravenous antiviral medications such as sotrovimab, which can reduce hospitalisation and death in vulnerable individuals with COVID, but must be given early in the piece after diagnosis, using an algorithm which determines who is at high risk of poor outcome and who isn't. The holy grail, of course, is oral medication, which can be given early in the course of disease to prevent hospitalisation and death. And there are now 2 effective oral medications on the horizon, molnupiravir and ritonavir. And if and when these medications become approved and used in Australia, they'll put the management of COVID fairly and squarely back in the territory of general practice. But that's a subject for another update in the future. I hope that's been helpful.